This is a presentation on anaphylaxis. So this picture
By
shows
Dr. Ignatius
basically
Cole.
an overview of anaphylaxis and the brainstorming. You can see what the anaphylaxis is actually linked to, pollen antigen, sensitivity. It is a sickness. It occurs in people with vulnerability. Okay, so medications. There were antihistamines. So this is just a basic overview. There is shock, and this is the basic pathophysiology of anaphylaxis and basically any other allergic reaction. Knowing this will help you to know the pathophysiology of any other allergic diseases. So there is an exposure to antigen or allergen, and the B cell sees the antigen and triggers the production of IgE antibodies. The IgE antibodies go on to bind on the surface of mast cells or basophils, and subsequent exposure to the same harmless antigen or allergen like pollen, hay fever will cause there is a bridging of gap between the antibodies, the antigen allergen in the mast cells, basophils. So this allergen will bind to the IgE on the mast cells or basophils, and the mast cells will degranulate to release the histamines and other mediators. And the histamines and other mediators will increase its permeability and distance of the blood capillaries, resulting in symptoms. This is the same mechanism in allergic rhinitis or asthma or multitude of other allergic diseases, even dermatitis. This is the same mechanism. So what is anaphylaxis? It is actually the severest form of allergy. The anaphylaxis is a potentially life-threatening systemic allergic reaction caused by release of histamine and other vasoactive mediators from mast cells. So knowing the pathophysiology, the definition is quite easier, and the risks of death due to anaphylaxis increase in patients with pre-existing asthma, particularly if the asthma is poorly controlled and when treatment with adrenaline is delayed. So adrenaline treatment with adrenaline is a must. So what are the clinical manifestations of anaphylaxis? There is a presence of impending doom, and there is a potential trigger. You can know by asking the history. There is a loss of consciousness. There is angioedema of lips and mucous membrane. So there is the accumulation of water or inflammation occurs deep down to the submucous membrane. There is both the edema of mucus and submucous membrane, so resulting in angioedema. There is a conjunctival injection, which basically is a fancy term for conjunctival redness. There's flossing, sweating, wheeze, bronchoconstriction, laryngeal obstruction, stridor. So these are wheeze and bronchoconstriction typical of asthma, laryngeal obstruction, stridor typical of respiratory. There's cardiac arrhythmias, there's hypotension, there's urticaria, there's diarrhea and abdominal pain. The GI system is also affected, and there's itching of palms, soles of feet, and genitalia. So this is a clear picture showing what happens. So you can see sudden itchiness, odd behavior. This is especially in children. Puffiness, floss face. This picture can be used to remember the symptoms. So this is a girl showing there is a puffiness of swelling of eye. There's angioedema on the lips or on the eyes. This is these are urticaria or commonly known. So what are the differential diagnoses? For the loss of consciousness, the differential diagnosis can be vasovagal syncope, cardiac arrhythmias, myocardial infarction. Respiratory distress can be due to status asthmaticus. Causes of laryngeal obstruction, C1 inhibitor deficiency, idiopathic angioedema, especially if the angioedema occurs regularly, C1 inhibitor deficiencies must be kept in mind. Causes of general flossing can be systemic mastocytosis and carcinoid syndrome. Other causes may include pheochromocytoma, so these differential diagnosis should always be kept in mind when you see a patient suspected of anaphylaxis. And what are the causes of anaphylaxis? There are basically, and it could be anaphylaxis, which follows the previous mentioned pathophysiology, that is IgE mediated post-cell degranulation, or it could be anaphylactoid reaction without any IgE mediated reaction. So the cause can be foods like peanuts, milk, tree nuts, fish, shellfish, eggs, and soy products. Mostly protein-rich foods are responsible. Insect stings, be it bee venom or wasp venom, and chemical drugs and foreign products like IV anesthetic agents, example succinylcholine, penicillin, and any other antibiotics, latex. Any drug can cause anaphylaxis, but these are the important ones. And there are anaphylactoid reactions which are non-IgE mediated. Mast cell degranulation, I told you, can be caused by drugs like aspirin and NSAIDs, opiates, and radio contrast media, and physically exercise and cold. and in 20% of cases of anaphylaxis, the cause cannot. So investigation, measurement of serum, muscle tryptase, specific IgE tests, and skin. So anaphylaxis is quite a emergency condition, so it should be managed stat if you want to save the life of the patient. So of course you want to. So at first you should prevent further contact with allergen. So if there is any allergen around or the patient is still in contact with allergen, there is a bee sting pinched into his skin, remove it. Ensure airway patency. Airway patency can be ensured by three simple steps like jaw thrust, chin lift, head tilt, or you can even need to do insert a laryngoscope. You should administer intramuscular adrenaline, which is quite the life-saving drug. Its adult dose is 0.3 to 0.5 ml, 1:1000 solution, which is quite a high dose. It acts within minutes, and you should repeat the dose at 5 to 10 minutes if the response is inadequate. Moving on, you should administer antihistamines, which can be like chlorpheniramine 10 mg IM or slow IV injection. The chlorpheniramine antihistamines directly opposes the effects of histamine released by activated muscles. You should administer corticosteroids. Hydrocortisone is a fast-acting corticosteroid 200 mg IV. It prevents the rebound symptoms in severely affected patients, and it should provide supportive treatment because there is bronchoconstriction, nebulized beta-2 agonists like salbutamol, and you should give intravenous fluids to restore or maintain blood pressure, and it should give oxygen. So there are 5 main things which can be adrenaline, and there is antihistamine, there is corticosteroid, there is beta-2 agonist, and oxygen. These are the must if you have to save the life of patient in anaphylaxis. Thank you. Please subscribe to Ignatius School and keep tuned for more medicine videos.